In this afternoon's Health Alert, a warning from the CDC about a spike in measles cases and outbreaks here in the U.S. and beyond. So far this year, there have been 58 confirmed cases nationwide. Now, that's equal to the total number of cases we saw in all of last year. Those cases have been reported in 17 states, including New York and New Jersey. Officials say 93% of the cases this year have been linked to international travel, mostly in children who did not have the MMR vaccine.
All right, let's talk measles. We got with us ABC Medical Correspondent Dr. Darien Sutton. And Darien, let's talk about the symptoms first of all, and how dangerous is measles?
Well, we know measles from what it looks like in those textbooks, the rash, that stereotypical rash that covers the body. But what people don't often talk about are the complications of measles, which don't just include a rash, but can include something called encephalitis, or inflammation of the brain. That can lead to permanent harm. We're talking about deafness, blindness. These are complications that are very real and reasons why we advocate for vaccination.
Okay, so we talked about most of the cases being in children.
Yes.
That means we've got to have a conversation about vaccines.
Yes.
Are we still getting them at the numbers we should be getting them at? And you know, when do you get vaccinated for measles?
Great question. So the MMR vaccine, which includes vaccination against measles, the other M and the R stand for mumps and rubella, that's given in childhood. So the majority of those who have gone through formal education have required to get those vaccines. So we can expect that during the pandemic and a time before, we saw a decreased participation rate in children getting their routine vaccinations. It's likely associated to these rising rates that we're seeing here. Guys, measles is so infectious that if you're not immune to it, sitting next to someone who is infected, there's more than a 90% chance of you getting it. And so it's just really important to understand the benefit of that vaccine, which is up to 95% effective in preventing infection.
You know, what I'm afraid of is that we're in an era right now where there's a lot of misinformation about vaccines that are being spread out there. And consequently, the big cases that we're seeing in this particular outbreak are from unvaccinated people. Absolutely. So my question to you is, how quickly could this spread? How bad might this get at this point?
Well, when we look at viruses, we look at how infectious they are, and we use this number in science called an R0, for example. That's how many people will get infected from one infected person. Let's use the flu as an example. One person with the flu will likely get 3 to 4 people infected. That's what we would expect. With measles, one person infected with measles will likely get 12 to 18 people infected. Wow. So that just helps you to understand how infectious this virus is. But again, vaccines are so incredibly effective that they're up to 95% effective in preventing those infections. So it's a reminder to parents that if you're not up to date, to get vaccinated. And most importantly, if you're going to travel internationally and you're over 6 months of age, you need to get vaccinated to protect yourself.
And one last question, because it probably affects, well, I don't know, you're young, so maybe it won't affect you. But those of us that got vaccinated when we were younger, is that something that we need to be concerned about getting revaccinated for, or are you one and done?
That's a brilliant question. You know, when we look at the longevity of the benefit of this vaccine, we don't see any problems as those who get older. We don't see any differences really in terms of the risks. But if you have immune compromised status, or if you have other problems within your medical history that might make you more susceptible to infection, that's an important conversation to have with your doctor. But overall, for the general public, once you're vaccinated, you've finished that process.
And we're running out of time, but I just want to follow up. Has been proven any real issues with this vaccine?
The MMR vaccine is safe and effective, been used for over a decade. I understand the concern with any new vaccine, but this vaccine is pretty much textbook and helpful. Wow.